have too many. So I don't know if my boyfriend would actually like that, but no. So, well, all right, I guess we can get started. My name is Mary Truax. I am one of 4 County Veteran Service Officers who works for Dakota County, Minnesota. We have 3 main offices in the county. We have an office in West St. Paul, and that's where I currently work. We have an office in Apple Valley where we have Phil and Tim. Tim is there full-time. Phil is our newest CVSO, and he works there part-time. Joel and I work in West St. Paul, and then Phil goes to Hastings a couple times a month. So we also have an admin manager, Carly, and our admin staff is Kim. So the business card that you all picked up is for our main office number. So if you call, you're going to talk to Kim, and she will set you up with a case file if you don't have one at the county already. And then she will ask you where you want to be seen, and if you want to be seen in Apple Valley or if you want to come up to West St. Paul. So that's kind of how that works. And you know, I have come down here before, so we can actually do home visits and that kind of thing. Beverly set me up in one of the library rooms once for like a couple days because I had so many people that wanted to see me. So if there's a lot of you that want to have one-on-one appointments with us, then please let Beverly know or Mary know, and we can get something set up. And I can bring my printer and my computer, and we can do everything here. So that would be fabulous. Okay, so a little bit more about me. Okay, so I have worked for Dakota County for 26 years. I've been a County Veteran Service Officer for 14 of those years. Prior to being a service officer, I worked in the welfare department, so I worked with elderly and disabled people. So it was a really natural transition for me to go from that department to veteran services. I'm also a veteran myself, because you have to be a veteran service officer in Minnesota. Every county in Minnesota has a veteran service officer, at least one. Dakota County has the 2nd largest veteran population in the state. So we have 4, which is not nearly enough, but we do okay. We keep up with everything, and people like calling our office. So Kim has a rule about making sure she returns all phone calls in 24 hours. At least she does same day. She's like absolutely obsessed with returning phone calls same day. You are? Is it too loud? Can we turn it down a little bit? I felt like it was too loud.
Yeah.
Is that better?
That's better.
Okay. Is that better, everybody? I felt like I was loud. Okay. And I'm loud. So anyway, I've worked for the county 26 years. Oh, I was in the military for 20 years. I joined the National Guard in 1987 while I was in college. I just said I can do anything 2 days a month, and 20 years later, I retired with 1 combat tour under my belt. I went to Iraq in 2004, 2005. I left my 8-year-old daughter at home with my husband and went off to war as a platoon sergeant. So I actually ended up working at, can you still hear me okay? Can you still hear me?
Pardon me?
I said, can you still hear me?
Yes.
Okay. All right. I just want to make sure that we're, Anyway, so I had a great military career with the Minnesota National Guard. And I'm here today to kind of talk about this book and just kind of talk about benefits in general. So I know it's about planning your legacy. And I don't know. I think you need to plan that a little earlier than now. But that's just me. But we'll try to set up some nice stuff for you now. So this book has a lot of information in it. There's a lot of forms in here. Please do not fill out any of these forms without my supervision, okay? or my coworker's supervision. We get paid by the county to help you, okay? So please take advantage of that, okay? Call us, we're here to help you. No one should try to navigate the VA by themselves. It's a tough proposition, and if you don't get it right, it just really messes up and takes a long time. And so, so the first thing we always talk about when we talk about VA benefits is we talk about compensation. So anybody here go to the VA? Okay. Okay, good. Just for audiology? You know you can. Do you have a service-connected disability? No. You don't get money from the VA? Oh, see? Compensation, people. What'd you do in the military?
Navy.
Okay. Where was quarters?
Baby fight that.
What?
On a ship.
On a ship, right? Yeah. So did you fire the big guns on the ship?
Sure.
Sure. Did you work in the engine room?
No.
Okay. So he fired the big guns. So his hearing loss that he goes to the VA to get his hearing aids for, that could have started in the military.
What?
It could have, your hearing loss might have been caused by the Navy.
No, it got caused because I'm 99 years old.
99? Did you know he was 99? He doesn't look a day over,
99 and a half.
he don't look a day over 80, man. I don't know. I can't tell ages anymore. Y'all think I'm in my 30s. But we don't know that your hearing loss didn't start because of the Navy. We don't know that.
No, I don't know where it came from.
Okay, so see, we should file a compensation claim for your hearing loss, and then you get some more money. And then prescriptions get really cheap at the VA. Prescriptions are between $5 and $11 per prescription per month. It's a good deal.
You know that?
See? Learned something already, and I just started. So compensation, injuries, illnesses, always, and boo-boos that happened while you were in the service, okay? So it's one of the programs that we do. There's how many war veterans do I have? Wartime? Wait, we just talked. You were post-Korea, pre-Vietnam, or did you serve for a long time? Okay, so
What's considered Korea?
50 to 55. So there's, I don't memorize things I can look up, and I have it on my wall in my office. So, but it's approximately 50 to 55. World War II, of course, at 99 and a half. Okay, so for my wartime veterans, there's a VA pension program. It's not about how long you served in the military. It's about it's a need-based program for wartime veterans and widows, okay? So if you served during a war period and your income's getting all eaten up by the cost of your care here at Hosanna, at Fountains, because it's expensive, and your assets are under $139,000, we might be able to work that program for you. So that's another program. Some people refer to it as aid and attendance. Aid and attendance is just a level. So we have pension, we have homebound pension, and we have aid and attendance pension benefits. So that's another program that we have. I have to go through my list of things. None of you are going to buy another house. Who goes to the VA for health care? You do. Mm-hmm. Okay. And just for your hearing, though?
Yes.
Okay. And do you go for everything? Quite a bit? Hearing? Okay. If you can go for hearing, you can go for other things. So, and I'm not sure, I think Hosanna lets you bring in caregivers, is that right? Yeah. So if you needed someone to come in and help you take a bath, the VA, if you have a primary care doctor at the VA, you can talk to them and they can set that up so that you don't have to pay for it. and the VA will pay for it, okay? If you need your medications set up, if you need a nurse to come in and take care of your big toe, so there's like things that you can get the VA to pay for instead of having to pay for it out of your own pocket. So, have I lost you all? Are you confused yet? Okay, good. All right. So I go to the VA for all of my health care. I am also an 80% service-connected disabled veteran. I have a lot of, I was 34 years old when they sent me to war. And I left my kid and my husband at home and had a bad experience with my chain of command. And yeah, so I didn't come home. My head wasn't screwed on very well. So that's kind of a little problem for me. So, and I got bad knees and I have ringing in my ears. And so I have a bunch of stuff. But I go to the VA for all of my health care because I really like it out there. They take very good care of me. Like I said, prescriptions are really cheap. They mail them to your door, right? They mail them right to your house. So you can get them sent right here. I also have sinus problems. My throat gets dry. What, hon?
I just recently had a bladder type operation, and it's something new. I called the VA, and they said, no, we don't pay for that.
Oh, well, they won't pay for it if you went outside of the VA for it.
The VA didn't do the specific procedures.
Oh, so you had to go out. Well, they could have outsourced. They could have given you community care to go outside of the VA, too.
Yeah, I have that veteran's choice.
Yeah, yeah.
You know, where I just tell the people in the VA they contact,
Yep,
but that's what they did with this operation.
yeah. Yep,
It's so new.
yeah. Well, that's good. And the surgery went well?
They didn't cover it though, because it was,
Oh, okay. Well, that's a bummer. So what he was talking about is, like, I had to get cataract surgery. I had cataract surgery in my 40s. And so because I had LASIK surgery and a bunch of stuff and they couldn't find all the records, they outsourced me to go to a private provider. So actually the guy who did my LASIK surgery ended up doing my cataract surgery. So those are options too. Like, I have a lot of vets who live in Hastings, and they get a lot of their even primary care outsourced to one of the clinics there in Hastings because it's such a drive. Not that it's that bad, but So a lot of people get that kind of care, but you just have to work with the VA to get that kind of care. His surgery was probably experimental or really new, and so they didn't cover it. But that's just what happens sometimes. But I think the VA is really good about that kind of stuff. They offer urgent care visits. And emergency prescriptions. So there's ways to use it for everything. If you have to go to an emergency room, though, and you're a patient at the VA, you need to tell the emergency room where you're at right away that you're a VA patient, and then they can get that covered for you, okay? I hope they can get that covered for you. I never promise anybody the VA is going to cover anything outside of the VA, but if we do it all in the right way, then we have a better chance of getting it covered. And I'm sure most of you have Medicare anyway, and probably a supplement as well, which is just fine. If you go to the VA, though, and you get your prescriptions, you don't have to have a Part D program. You can just get your drugs at the VA. No, but they could. You just have to have a primary care doctor out there to write those prescriptions. Yep, well, but you can get one. They do a lot of co-managed care, so they can work right with your primary care doctor at Health Partners or Allina or wherever. So they do lots of really good things to try to support our veterans as best they can. So also about the pension, I'm gonna skip back a little because I'm watching this lady over here and I'm thinking, I gotta talk about my widow benefits. I don't know if you're a widow, but that made me think that you're here by yourself. So they have widow benefits, and the pension program is also a widow benefit. So if your veteran was a wartime veteran, then there's that program could also cover that. Let's see, what else? Well, this book talks about the other thing that I kind of want to touch on is dependency and indemnity compensation. So if you're a widow and your husband died of a service-connected disability, then you could be eligible for some benefits based on that disability, that death due to disability. So I've had widows come in and their husband had a heart attack, and I looked on their discharge papers and found out he was a POW during World War II, and heart disease and heart attacks are contributory of being a prisoner of war. So I was able to get her this DIC, or dependency and indemnity compensation payment. Or someone whose husband died of lung cancer, and he worked in the engine rooms in the Navy because there's a lot of asbestos there. So I've come across a few of those over the course of the years that I've been doing this too. So, and then along with this book here, which has like a lot of stuff in it, everybody always wants to know how to get into, what do I have to do to go to Fort Snelling for burial? Well, you have to be dead. And it's first come, first served, so they don't really reserve any spaces for you. The only time they reserve things if you're a dual member family. So if I was still married and my husband died, I could reserve the spot next to him because he was a veteran and I'm a veteran. So, but otherwise, there's plenty of room. They haven't told me I should stop selling Fort Snelling, right? People should still be happy to go out there, and it's a lovely place to go. I was just talking to a couple of the guys that work out there, and they just seem like really great, happy guys. So they are the groundskeepers out there. So what I do recommend is that people go in and talk to a funeral home and pre-plan and prepay for their funerals, and then take your discharge papers to the funeral home, and I always say marriage certificate and discharge papers, because then we've got them covered for getting your spouse there too. So you just go talk to a funeral home, and you can tell them everything you want. Like, I don't want any red flowers. I don't want any pink flowers. I want only white flowers. Okay, great, whatever, but you get what I'm saying. But then you can tell them, nope, I want to be cremated. I want this, I want a brown grocery bag, and we'll just take me out to Fort Snelling. I don't know. Because you can do whatever you want, right? You can tell them whatever you want. And if you tell them whatever you want, the kids aren't changing it. The kids will just leave it. No, actually, I used to do these with White Funeral Home, and Meg Hines is the daughter of Jim. And she would say that, like, she's never had a family come in and change whatever you wanted anyway, so you can tell them what you want and they'll just do it, because that's what, and then it's paid for, and the kids don't have to wait for insurance money or pay for it themselves and then get reimbursed, and it's such a hassle. Yes, darling?
Double question. If you're cremated, could you still be in the grave section or no?
Yeah. If you want to be buried at Fort Snelling, but you want to be cremated, they have plots that are good for that.
Yeah, but what if you wanted to be
If what?
in the West 40, you didn't want to be in the cremated part?
Yeah, that would be fine. I don't think, they don't have to put you in one of the columbariums. You can be buried. I think out there all the spaces are all the same, so whether you're in a casket or you're cremated, I think it's all the same space. So you don't get to pick where you're gonna go. it's first come, first serve, so whatever the next available spot is. And then, of course, it's all, it's not Fred and da-da-da-da-da, but they bury one guy here and one guy over there. And if you've been out there, they have it all scheduled out 15 minutes apart. So the honor guard can get on the bus and get back and do their part, so.
Another question.
Yes.
If your spouse dies first,
She just holds on to that apartment for you until you get there.
okay.
Yep. So they'll put her out there, and then they'll put her information on the front, and then when you pass, they'll pull it up and turn it around and put your stuff on the front, and her stuff will be on the back, and you both will be buried there in the same plot. So as far as I know, they can bury up to 4 people in one plot, but it has to be a dependent child or a helpless child. So usually it's just husband and wife, or wife, You'd laugh, but you'd be surprised. You go out there sometime, you check out some of the, oh yeah, no, so you can, husband, spouse, and if you ever go out there and look there's babies out there, and there might be wives out there without their husbands because they died young, and then the husbands moved away and they got buried someplace else. So there's a lot of interesting things out there once you kind of understand how they mark the graves and how they do it. So yeah, I was just in Arlington too. So that's why I was like, they have places in Arlington where they just have markers and there's not anybody's remains there. So it's kind of more of a memorial garden type situation. So they do that on hills and places where you can't bury things. So, and Arlington isn't a national cemetery. That's an Army cemetery too, by the way.
What if you're not buried at Fort Snelling? Are there some benefits? Are there like grave markers or?
Yes. All that information is in here. There's lots of good information about the markers in here. Let me see. So where did that go? So if you get buried at a private cemetery, you can get a marker. If you're service connected, there's some plot allowance. So if you pay for the plot, you can be reimbursed if you have a service-connected disability. See, another reason. And if you're service-connected, there's also reimbursement for some of the funeral expenses. It ranges anywhere from $300 to $2,000, and sometimes a little bit more if there's transportation, if you died at the VA hospital or your care was being paid for by the VA hospital. So there's a lot of weird stuff that goes on. And you know what? If you have questions about that, just come on in and we can take a look and figure it all out, okay? Sometimes I just send in the apps and we see what happens and then we'll go from there too. But in here, yeah, there's information. I don't know what page it is, I'm sorry. Yeah, but there's, oh yeah, so right here,
What page is that?
it is on page 34. I don't have my glasses on, so, but, yep, this is page 34. So these are all I think there's actually more than this, and you can go online and find more marker or emblems, religious emblems that you can put on there. And then this asks all the information about what you want on the marker. And then if you're going into a private cemetery, you have to have the cemetery say it's okay to put that kind of marker in our cemetery. And they need to be able to take it on delivery, because if you're ordering a marble marker, that's big and heavy and you don't want that delivered to your front door. All of that being said, I just ordered a niche marker for someone who was going to have, a couple's gravestone put in, but you can still get, let me see, it's on here. So they have these smaller little bronze markers that can go on like the back side of a marker, if you want something to still remember that he was a veteran, but mom insists on having a great big pretty heart there because she loved him so much. Okay. Or he did, maybe whatever, but so I've done that for people too. So, and then Dakota County, the state of Minnesota and Dakota County, if you're going into a private cemetery, we have the bronze star markers that have a slot for the flag. So you can get one of those from our office or any, well, if it's in Dakota County, you have to come to our office, but we get them from the state, so all the counties in Minnesota have them. But that, we say put them out and then take them back because they're bronze and people steal them, so we don't want that happening to you. It's a bronze star marker. Bronze star. And then the state has cemeteries. So we have Preston, we have Little Falls, we have one in Duluth. They're getting one in Redwood Falls. And I can't remember where the other one. What?
You don't have one in Gully.
No, not yet. Not yet. Where's Gully? I don't even know where that is.
Northwest of Bemidji.
Oh, yeah, no. Oh, well, that's a lovely place to go. How quiet and peaceful that must be. So those are state cemeteries. I have a flyer about the state cemeteries, so that's an option as well.
One of the benefits then, you could go there for no price?
The veteran can go there for no price. Spouses pay $750. So there's a little bit more involved in that. And this is all through the Minnesota Department of Veteran Affairs. So when we talk about planning your legacy, and what I think about is people who want to, how you're aging and how you want things left. And I know everybody wants to save, give money, hope that there's money left to give to the kids. And, one of the ways that we can do that, the Minnesota Department of Veteran Affairs has veterans homes, okay? So they do allow, so currently right now in Minneapolis, it's about a year and a half wait to go into the vet's home. So if you're looking that you might need that kind of care, you might wanna get on that list. If you're married, you can transfer your assets 1 day prior to being admitted, okay? So if we're putting Bob, no, I don't know, what is it? Stan. If Stan is going into the vet's home, then his wife, daughter, sorry, I didn't mean it. So I need a husband, wife. Oh, here, we'll use these two. So we're gonna transfer all of, your money to her and then put you in the home. So she's stealing all your money and putting you in the home. Is that okay? No, it's like not taking it with you. You're not taking it to okay, so the Minneapolis vet's home allows transfers spouse to spouse 1 day prior to going into the vet's home. And then if you have less than $3,000 in assets, then you just use your income to pay for your care there, okay? They let you transfer it to anyone else. I'm not a big fan of transferring it to just anybody else because, he transfers it to you, you spend it all, he falls down, has a stroke, and now you spent all his money, and now the state's gonna have an absolute temper tantrum because he gave all his money away.
But it's different to the spouse, you're saying?
Yeah. Well,
Because they can get it from the spouse.
Well, when the state does medical assistance, they look at a household of 2, no matter what. And the vet's home will only look at the person who's going into the vet's home. So it's a little complicated, but it is a way to preserve assets for the community spouse, okay? So, and if you trust your kids and they're not gonna spend all the money, fine, transfer it to the kids, go into the vet's home, I don't care. But you have a year wait from when you transfer to when you go into the home. And I just see too many things can happen in a year while you're waiting for that to happen. So And then, I think it just doesn't work out that well. So the state of Minnesota has I think they're gonna have seven full care nursing homes now, because we have Minneapolis, we have one in Silver Bay, we have one in Laverne, we have one in Fergus Falls. They're putting one in Montevideo, and they're putting one in Preston, and they're putting one in, I think, Redwood Falls. So we're gonna have like 7 vets homes. They're adding about 150 beds with the new ones.
Hastings one?
Yeah, Hastings is a domiciliary, so that's more of a boarding care situation. And there's, I just wouldn't want to go there. It's not personal. I don't think it's a great place for elderly people to go. There's a lot of younger vets and people with mental health problems and some substance abuse problems. So it's a safe place for them to be, but it's more like a college dorm situation. So you're not getting the 24-hour care that you do at Minneapolis. So there's 2 domiciliaries. One is in Hastings and one is in Minneapolis. And I'm not saying Hastings, the guys who live there like it. It's fine, I've just been out there and visited it a couple times, and I'm like, I've been waiting for them to fix it, and they've said they're gonna build another one, and now they're talking about raising it and building a whole new one. I'm just waiting, because they keep telling that they're gonna do something with it, and they don't. So, let's see. I don't know, maybe we should just have some questions now. Did I at least spark some stuff in you guys today? You have to forgive me. I used to do these all the time, and I feel a little out of practice. So,
I think
okay.
I think my dad has a case file, but there might be benefits of going back and meeting with one
Yeah.
of the reps. Or do we just call this line and make an appointment then?
Yep.
Are there some papers we should bring for those appointments, or we just show up empty-handed? Or?
Discharge papers. So if you were served during World War I and World War II, you had military separation papers. After that, like Korea era, they had what they call DD-214s. So a DD-214 is a military discharge. So that's the paperwork that most veterans have now. So
Can they get that from
we can work it out. Yeah. There's archives.gov, and if you're interested in getting any of the medical records, you can put in a request to get all of the records there if you want to try. If they have worked with the VA may already have those, and we can put in a FOIA request to get those if you want those. I did that with my grandfather. He was in the military for 20 years. Unfortunately, there was a fire in St. Louis in 1973 that burned up a good portion of the Army records and a good portion of the Air Force records. So prior to like 1954-ish, I think. So I have to look. It's one of those things. But there was a fire there, so it's okay. I mean, they can still recreate things. They use other means, and then they can still send you something verifying that military service. So,
When do you come to your office?
what?
When do you come to your office for help?
Well, when do I come to my office?
No, when do we come?
Whenever you want.
Okay, for anything or what?
I've answered questions about just about everything in the last 14 years. So, but yeah, you can call our office. Maybe we can just resolve it on the phone. I work in West St. Paul, so that's a little bit farther for you guys to drive from here. It's like 15 miles. It's not that bad. It took me 20 minutes. It might take you 20 minutes on 42 to get to Apple Valley. It's a crazy, 42's crazy. But like I said, I can come here too. I've done home visits all over at lots of the senior living places. But yeah, you can call us anytime if you have questions or need something. Believe me, we have answered every question. I don't think there's a question we haven't answered in our office about anything. It's the strangest thing. People call us about everything. So, yes. Did you have anything in particular?
No, I'm just, I didn't get any whipped cream on my pie.
Oh, I'm sorry. Sorry, you got to ask. It's important to ask for those things. That just reminded me, I was on the honor flight. I went to Went to DC, and we go to this place, and I'm like, they never give us whipped cream on the pie, and I always want whipped cream on the pie, and I tell them every time I want. He's like, really? Are you serious? Okay, other questions?
Thank you.
What? Okay. All right, so I got some other stuff in here. I got some cards and chip clips, and I was going to hand them out when people ask questions, but do you want a deck of cards? You want a chip clip? You need cards.
You got all the answers.
I try.
You do.
I try.
You sure
I
do.
love my job, and I love my veterans, so every time I do a review at work, you're welcome. Would you like a deck of cards or some hand sanitizers? What do you want? Nothing? Chip clip, okay. So, I mean, unless you have more questions, I mean, I don't want to keep you any longer. These ladies in the back just look like they're full of questions.
We're not sure.
Oh,
We probably just missed it. But we're wondering, a friend of mine, her mom got some support when she moved into senior living. So our big question was, our dad is to that point. And would he wasn't in during wartime.
okay,
He was 57 to 59 and then in the reserves.
okay.
I'm thinking that doesn't qualify.
That time frame is a tweener time frame.
Yeah.
So 57 to 59 is in between the wars. But if we got him enrolled in health care at the VA, he could possibly get some assistance from the VA for some of the medical stuff. Like wheelchairs, like walkers, like Depends, like those adult underwear things. Yeah, thanks. I don't like calling them diapers, but yeah, I mean, there's a lot of, and having someone, maybe he needs some help taking a shower, then they can send someone in to help pay for that. So that would be a situation where you probably want to come in and talk to us, and then we can, and then the cost of prescriptions are they're between $5 and $11 per prescription per month, okay? Inhalers are $50 to $75 through almost every single insurance out there, so they're very expensive. They have a formulary on the VA. You can look up VA formulary. I don't know, my computer's intuitive now. It always just pulls up what I want, but.
I just know the drug that he's on right now is $13,000.
Yeah, so you can look on there, and even if it's not on the formulary, that doesn't mean they can't get it for him. They could, so.
And then how about?
What? Yeah.
Would they support anything as far as like, if he does come home, I guess we're looking also for, support for mom at home for some hours during the day?
They could possibly do some of that care. Yeah, possibly. The county has a lot of programming too. So there's elderly care, there's alternative care waivers, there's other waiver programs. Those are all based on income, and assets and that kind of thing. So those are programs too that can sometimes cover where the VA can't. So, I mean, he's not even like, the wartime veteran thing is just a way to get more money. So that doesn't preclude people from getting other benefits. I mean, there's just like one program that's a wartime veteran benefit. So, and maybe depending on, what he did and where he served and that kind of stuff too, maybe what he has is something that, was he in the Navy and he has lung cancer, I mean, and then they just passed the PACT Act, and it included a whole bunch more places for toxic exposures too, and some of the dates shifted a little bit, and there's radiation exposure place. I mean, there's a lot of things. So if people haven't come in to see us, to at least have us sit down and look at what went on, it's pretty hard for us to say, yeah, there's not anything. So, if you're gonna come in and see us and you want to talk about healthcare, then I always say bring in your taxes from last year, because that's what they look at. Because there's 8 categories of eligibility for healthcare, so there's a lot of different things, but if it doesn't fit into any of the categories, then we always have to look at income. So that's kind of a caveat there, but give us a call. Where do you guys live? Here? Oh, okay, yeah, so you can come up and see me, or you can see Tim or Phil in Apple Valley, so, yeah.
But for any of that, you would probably have to have a doctor from the VA.
Yeah, you need to have a primary care, yep, you need to have a primary care team, because you can get it, and then with a primary care team, you get a social worker, and you get nurses, and you get, it's really a nice, they're very good at rounding out all of the services that they can do for people, but you gotta ask. You always have to ask for what you want and tell them what's going on so that they can help figure out what can they do for you, They have a geriatric research program, so I send a lot of people out there for that. That have cognitive issues. I'm like, get involved in this program, in this research thing, because they can offer adult daycare, they can offer respite care and that kind of thing too, and hospice care. So there's just so much that the hospital can do. So, yeah. So, what? I know, wheelchairs. How are you, honey? Good. Haven't seen you in a while. I know.
Thank you very much.
Oh, you're welcome. So, yeah. Oh, did you want some cards or a clip or?
No candy in there.
No candy.
No candy in there.
I know, I'm sorry. I should have brought some. Are they not letting you have candy?
No whipped cream.
No whipped cream? Are,
Not as long as he's here.
oh, okay.
He's watching me.
I'm taking this off because no one can hear me anymore. I'm too close. I have a big voice as it is. Thanks, Corey.